A British toddler who was born deaf can now hear unaided after becoming the first person in the world to receive a new gene therapy treatment. Shortly before Opal Sandy's first birthday, she was given an infusion in her ear, which replaced the faulty DNA with a working copy of the gene. Experts from Cambridge's Addenbrooke's Hospital say there's huge potential for this new treatment. Our health reporter Michelle Roberts has the story.
Opal's turn.
18-month-old Opal is learning how fun making noise can be.
Yeah!
She's the first person to get a new type of gene therapy treatment for an inherited deafness she was born with. Her parents, Jo and James, say it was a really hard decision to make.
It was really scary, but I think we'd been given a really unique opportunity with no real evidence that any harm or adverse effects was likely to come to her. And I think a lot of parents, regardless of their difficulties their children face, to be given an opportunity to potentially make obstacles easier for her to overcome was a risk definitely worth taking.
Surgeons carried out Opal's procedure just before her first birthday. The infusion replaces the faulty DNA causing Opal's genetic condition. A modified harmless virus delivers a working copy of the OTOF gene. That treats the sound-sensing cells in the inner ear or cochlea. The new gene means they can carry the signals they should. Opal's operation went to plan. Gene therapy in her right ear and a cochlear implant in her left. Just a few weeks later, she could hear loud sounds.
Absolutely mind-blowing. You were
I was
at
at work at the time, and you messaged me to say what had gone on, and I'm not sure I believed it at the start. I think said it was just a fluke. She must have reacted to something else. I got home from work and was straight away take the cochlear implant off, testing it out.
Banging from the bottom of the stairs.
Good, I'm shy.
Now she can even hear whispers in her gene therapy ear.
That was 24 weeks post-surgery. And we heard the phrase near normal hearing. She was turning to really soft sounds.
Yeah, and they played us the sounds that she was turning to, and we were quite mind blown by how soft it was, how quiet it was. Like they're sounds that I think in day-to-day life you might not even notice yourself, sort of thing.
Hiya, ladybird.
Opal's part of an international study, and experts hope the treatment could work for other types of profound hearing loss too.
This is a very specific gene for quite a rare type of hearing loss. So what I'm hoping is that we can start to use gene therapy in young children, restore hearing for a variety of different kinds of genetic hearing loss, and then have a more one and done type approach where we actually restore the hearing. They don't have to have cochlear implants and other technologies that have to be replaced.
Go on then, Diego.
Big sister Nora has the same rare gene as Opal.
For Daddy. Good girl. Keys for Daddy.
More than half of hearing loss cases in children have genetic causes, so there's big potential for this new type of therapy.
Well, Michelle joins me now from our newsroom with more on this. Michelle, you mentioned that this was part of an international study. Just tell us more about that.
Yeah, so they're starting small. They'll be doing a few children. Opal's the first one, so until now it's only been tried in animals. So you can understand when we heard from Jo just then, Opal's mum, how nerve-wracking it was to actually take that leap of faith to try it in their daughter. But they're starting with a few children to begin with, just in the one ear. If that all goes well, then they'll be starting to try it in both ears for children with this same type of gene.
So this is particularly for people who have this inherited hearing loss. Personal admission here, Michelle, I'm deaf in my right ear. How might this help people who have hearing problems that aren't inherited?
So this is for a very specific gene, this particular therapy at the moment. But the hope is that if there are other ones that are genetic have genetic causes, then you could change the type of gene that you put into the therapy and treat more conditions. We know that gene therapy as a whole is being used in a lot of different medicines now. You know, they're using it to try and tackle things like cancer. So it's a really exciting therapeutic area. But it's important to point out that it is an option. There are lots of other things out there in terms of cochlear implants and also people using sign language. So it's another option that people can think about.
And just before we let you go, just want to go back to Opal's story. You mentioned that her sibling has a similar condition, the inherited loss, but is being treated differently. How are the family doing, and how is this a long-term solution for Opal?
So the hope is it's a one-off treatment. I mean, we really don't know at the moment because it's early research, but that's certainly what the doctors are aiming for and hoping that will work in Opal's case. She does have, like her older sister Nora, a cochlear implant. So Opal's just got one in her non-gene therapy ear, whereas Nora has cochlear implants in both ears. And those are really good at helping a person who wants to hear some noises, but you have to train the ear to hear that sort of sound because it's not quite the same as the regular noises that might be other people would hear.
Okay, Michelle Roberts, thank you very much for taking us through what's a really interesting and important story. Thank you.